Hello everyone, we are Team 9 and today we chose to present on the topic of monoamine oxidase inhibitors, also known as MAOIs, and their association with combating Parkinson's disease. So as a little background information, what are MAOIs? They are inhibitors that essentially stop enzymes that are responsible for the destruction of monoamines, which are a type of neurotransmitters. Different types of monoamines include dopamine, epinephrine, and norepinephrine, as well as serotonin. Today we will be focusing on the monoamine known as dopamine, where an increase of this neurotransmitter could help treat diseases such as depression, anxiety, and even symptoms of Parkinson's disease. In the depiction of the pathway involving MAOIs, you can see that the green circle is a type of MAO inhibitor, where in its presence the red dots, which are dopamine neurotransmitters, are not degraded as much and therefore present in higher levels. From there, these neurotransmitters will travel from the presynaptic to postsynaptic neuron and can participate in functions like muscle movement. So Parkinson's is a disease that affects the nervous system where patients have limited motor control. This disease is most commonly marked by the patient experiencing tremors. Parkinson's is partially caused by a decrease in dopamine, a monoamine transmitter that is required for movement. When these MAOI drugs are taken, they stop the enzymes that would normally destroy dopamine and keep these neurotransmitters around. By having an increase in dopamine, there is a better chance for a Parkinson's patient to gain more voluntary movement.
Focusing into a particular research project that was performed at the National Institute of Neurological Disorders and Stroke, the question that they were trying to answer is whether or not MAOIs can be used to slow the progression of Parkinson's disease. Considering that MAOIs can help treat depression, anxiety, and motor functioning, which are all symptoms of Parkinson's, the drugs may show promising effects on both early and late Parkinson's patients. As part of the results from an experiment, the lab involved with NIH was able to conclude that an inhibition of both MAO isoforms A and B were found to lead to a decrease in dopal, a toxic dopamine metabolite that contributes to lower production of dopamine neurons. With this decrease in dopal, there is an increase in striatal dopamine, and this is significant because it helps slow down the progression of Parkinson's disease. As for future directions, the NIH could work on finding a way to making these MAOIs into drugs without any negative effects, such that patients could delay Parkinson's symptoms with the hope of one day curing the disease.
So to sum things up, here's our references, and thank you everyone for listening.